Are you navigating the complex maze of menopause and finding yourself battling unexpected weight gain? You're not alone, and it's time to arm yourself with knowledge and take control. In this video, I'll tackle the questions you should be asking about medications and their intricate relationship with weight gain, especially in midlife. This is about more than just shedding pounds. It's about making informed, empowered decisions for your health and well-being. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through menopause symptom-free, so that you can put an end to menopausal weight gain and the fat that comes along with it. So, as I mentioned a moment ago, the most important thing is that you need to know what questions to ask if you're considering using medication to help deal with menopausal weight gain. And so the first question that I tell everyone to ask, any doctor that is talking about prescribing medication for them, is how long will I have to take the medication? And so most doctors will tell you as long as you need it, which, since they're not doing anything to address the root cause of the problem, essentially what they're saying is forever. And forever is a totally inappropriate approach. If you do need medication to buy yourself some time to come up with a more long-term strategy, that medication would be taken for 3 to 6 months. And so you would also then want to ask the physician that's prescribing it, when you get ready to go off the medication, what is the process? There are some medications, like antidepressant medication, that is really, really difficult to get off of once you have gotten your brain and your body accustomed to it. So medication is not something you stop cold turkey. And so when you're considering starting a medication, you need to take these ideas, these factors into consideration. Just to let you know, I do not prescribe medication. If someone works with me and they're on prescription medication, we have to work collaboratively with the prescribing physician to manage the dosing and to work somebody off the medication if that is what they want to do for their long-term health. The next thing, now that we've kind of talked about medication generally, let's get back to talking about weight loss in particular. The weight loss drugs like Ozempic and Wegovy are semaglutide medications. Wegovy is just a brand name for semaglutide, and the dose has to be increased gradually over 16 to 20 weeks, basically to alleviate the side effects. And those side effects include gastrointestinal symptoms, headaches, dizziness, and fatigue. Ozempic is the same medication, but it's approved to treat type 2 diabetes. So what I have found is that some of the people that I work with, the women that I work with, have been put on one of these medications to help with diabetes. And so that's a topic for another video. But in any case, you want to ask the same questions and take the same things into consideration before starting any sort of treatment protocol that includes taking prescription medication. Prescription medication creates a powerful interruption to your internal signaling. And so as it does that, it impacts your body's ability to establish normal signaling. And we can never interrupt one signal and assume that it's not going to have other side effects and create other issues that are, in some cases, known in advance, and in many cases not really known or understood in advance. There are other medications Tirzepatide was previously approved to treat type 2 diabetes as Mounjaro. As Zepbound, it's approved to treat obesity in adults with a BMI of 30 or greater. And this is both a GLP-1 and a GIP receptor agonist. And so like semaglutide, it works by reducing appetite, and it's meant to be used in combination with diet and exercise to lose weight. It's also administered as an injection. So if you have an aversity to needles, you probably want to consider some other alternative. There is another one, liraglutide. It's a daily injectable medication as well that acts on hormones from the gut and sends signals to the brain to make the patient feel fuller quicker and decrease hunger signals. So the things I would caution you there is that one of the most important chemicals that is generated primarily in our gut is serotonin. And if your serotonin production is not happening properly, all sorts of things are going to go sideways, including your emotional well-being. So you think you're going to solve all your problems by losing weight, and then as a side effect, you're going to end up with other issues. Some of the other side effects include nausea, diarrhea, constipation, vomiting, headache, decreased appetite, which is basically the goal, fatigue, dizziness, abdominal pain, and renal insufficiency, which just demonstrates how much of a stressor these medications put on the kidneys. So this medication, any of the medications, are contraindicated for anyone with a family history of thyroid carcinoma. So just about every woman I work with either is on thyroid medication or considering thyroid medication. So if we know that there's some correlation between this medication exacerbating issues with thyroid, then why would you be recommending this medication for anyone with any sort of thyroid malfunction? It makes no sense to me, but you make up your own mind with your physician that's advising you. So the one that's kind of oldest and most widely used is phentermine, and it was originally used as a short-term medication to jumpstart weight loss. So in that particular case, I would have less of a problem with it because it actually is at least intended to be used short term. But the side effects included headaches, overstimulation, so similar to like what you would find if you were taking some caffeine stimulating supplement, high blood pressure, insomnia, rapid or irregular heartbeat, even tremors. So any of those side effects, as you might imagine, are really problematic and troubling. And then if you go to the doctor and they see some of these other symptoms, they're most likely going to be wanting to prescribe you another medication. So now you are prescribed a medication to deal with the side effects of another medication. It's a really slippery slope that's hard to come back from. So just say no if you want my opinion. Here's another one, topiramate, and that can be combined with phentermine to decrease appetite and cravings. Having the combination of two drugs apparently does increase the efficacy, but of course it's going to also compound the side effects. The side effects of this one include abnormal sensations like dizziness, altered taste, insomnia, constipation, and dry mouth. I can't tell you how many women complain about having symptoms of dryness, including dry mouth, and then I find out that they are taking allergy relief medication, not just short term, but long term. And don't be surprised when you're taking a medication that's designed to dry things up and that it actually dries up more than you would want it to. So with this medication, any of these medications, the contraindications include uncontrolled hypertension and coronary artery disease, hyperthyroidism, like I mentioned a few moments ago, glaucoma, and sensitivity to stimulants. The interesting thing with glaucoma is that in Oriental medicine, the eyes are directly correlated with the liver. And so there's another one of our organs of elimination, the liver, that is most likely under stress with these medications and what we're essentially asking our body to do. And so putting more stress on the liver when you're essentially trying to mobilize fat, and that fat includes a lot of stored toxins, don't be surprised when you are having issues potentially with your liver as well. Another one is naltrexone bupropion, and that combines an opioid receptor antagonist with an antidepressant to affect the pleasure rewards area of the brain and thereby decrease cravings and appetite. Now, this one, I've got to tell you, is like if you weren't already running for the exits, let's make sure that you're not even remotely considering any opioids. That is just not something that you want to even dabble in. The only time an opioid would even be considered would be if you are maybe post-surgery and in intense pain, and that opioid would be used very short term to deal with the pain. And for anybody who has a propensity to become addicted to things, you wouldn't even dabble with it after surgery. So the most common side effects of this one include nausea, constipation, headache, vomiting, dizziness, insomnia, again, dry mouth, and diarrhea. So interesting now, we've got the signs of IBS, right? Irritable bowel syndrome, because we've got alternating diarrhea and constipation. And so now how are you going to deal with the IBS from the food that you actually are eating? And then how are you going to unravel it and figure out what really caused the problem? So these medications should not be prescribed to any patient who has a seizure disorder. And then we've already discussed that if you've got issues and potentially are already taking opioids for chronic pain or even short-term pain, you definitely would not want to essentially increase the dose with this medication. So one of the things that I think it's really helpful to understand is that the feeling of hunger and the cravings are essentially hormone signals. So if you feel like that feeling of hunger and not being satisfied is just unmanageable, then there are definitely things you can do to help soften or quiet that hormone signal that is barking at you and just is relentless. So we'll talk about that a little bit more as we move into this information here. So midlife weight gain can be even caused by prescription medication. Some of the most common things that cause weight gain are antidepressants, steroids, and blood pressure medication, cholesterol medication. So it's really interesting. This is another thing that I see commonly where someone will have been put on either an antidepressant or a blood pressure medication, they gained weight, and now the doctor, potentially the same doctor or even a different doctor who maybe isn't taking the whole scene into consideration, prescribes a weight loss medication that's contraindicated if you're already on another medication. So remember what I said, it's a slippery slope. Once you start one medication, it becomes more and more complicated to unravel this mystery that is going to long-term be created with your health. So what we're essentially trying to do with all of these medications is suppress appetite and restrict calories. And calorie restriction may seem like the answer, but it's a race to the bottom. It causes stress and your body just adjusts to running on fumes. This is an example of one of the countless ways stress creates symptoms and other health issues, especially during menopause. I created a video that shows you how to eliminate menopause symptoms naturally, including this weight gain. So I'll make sure to link to it below this video. Make sure you hit subscribe too, because I share a lot of tips when it comes to dealing with stress that's become toxic. Relieving the nasty symptoms stress creates makes navigating through menopause a breeze. So let's go back to the discussion about hormonal fluctuations. They aren't the only force driving weight gain. So most people think that the changes in hormones that are happening during menopause is what's really driving the weight gain. And you could blame menopause and the hormone changes if you want to, but that's really just the straw that broke the camel's back, because what you've got is this underlying situation of chronic stress and adrenal fatigue. And when the hormone changes are added to the scene, it makes it really difficult for your body to manage things it was managing before. So one of the things that I want you to really look at is whether your problem is really weight gain or fat accumulation. I talk to a lot of women, and when we're evaluating their situation, they may have even managed to lose the weight, typically with some calorie restrictive diet, and they've still been left with body fat percentage that's too high, because calorie restriction is not the best way to approach this weight gain situation. You've also got the issue related to emotions, and we do find that as the hormones change, our emotions tend to fluctuate. We'll have mood swings, and so many of us have become accustomed to emotional eating, soothing our feelings of emotional discomfort with food, especially comfort food, which tends not to be the healthiest food for our goals. And so again, hormones are contributing to it, but if we were not accustomed to emotionally eating, and certainly we're not accustomed to eating processed, packaged, or foods that really were not healthy for us, then even if we were going through these emotional upheavals and mood swings, it would not tend to create as much of a problem. The other thing too, we find that we just are not feeling our best, and maybe you've got sleep disturbance, and when we don't sleep well, then we wake up and we just don't feel motivated. And one of the things that causes overeating is being tired. And we tend to find ourselves craving things that would kind of make us feel better, maybe provide a spike of energy, carbs in particular. And that happens more when we're tired and we're not feeling motivated. So as you can see, there's so many factors that are coming together to impact this situation. And when you look at the medications and their goal, which is essentially calorie restriction, then all your body does is adjust to the reduction in calories. And then what's going to happen when you start eating a normal amount of food again? Well, if your body has become accustomed to living on 500 or 1,000 calories, now when you start eating a more normal diet of 500 more calories, 1,500 to 2,000 calories, which should be a healthy amount of food, you're going to start accumulating weight. It's going to take your body a long time to adjust to the extra energy that you're giving it. The other big issue that I don't see anybody really addressing is the nutrient deficiencies. And you cannot get the nutrients just by popping pills in the same way that your body would process and create the nutrient combinations from healthy, nutrient-dense food. So if you are going to try to reduce calories, the only way that I recommend you do that is by using intermittent fasting with variations. And I have other videos on my channel that go deeper into my discussion on intermittent fasting and how I recommend that you use that. We even use that as part of my human energy system reboot that you can learn more about if you reach out to me. So if your best efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. In my next video, I'll show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate the symptoms that seem to be piling up in midlife naturally without medication, crazy diets, intense exercise, or any other unsustainable lifestyle hack.